You're listening to Civic from the San Francisco Public Press. It's been 4 years since COVID-19 changed our world.
The new public health order that we're announcing will require San Franciscans to remain at home.
And I thought to myself, I'm going to have to watch everybody die again.
Biomedical advances, vaccines, therapeutics. Let's put it all together and let's build up our trust because we have no idea what the next pandemic will be.
We discuss what we've learned, what we failed to learn from the past, and why it's important to remember the trauma wrought by COVID-19. I'm Mel Baker, and this is Civic.
Here for a vaccination?
Time's your appointment?
I'm at my local Walgreens in line for the latest COVID booster.
Are you Mel Baker?
Yes, I am.
You are here for COVID and flu shot, right?
Yes.
Now standing in the aisle with the cough drops waiting for my timed appointment and remembering.
All right, just wait outside 15 minutes.
Everything on Zoom. You're muted. Going out into the yard once a week to listen to everyone applauding for the first responders. The madness on how to stop COVID-19.
And then I said, supposing you brought the light inside the body, which you can do, either through the skin or in some other way. And I think you said you're going to test that, too. Sounds interesting. Right, and then I see the disinfectant, where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs. So it'd be interesting to check that.
The conspiracy theories.
We immediately threw the kitchen sink at it. All kinds of meds, monoclonal antibodies, ivermectin, Z-Pak.
Then getting that first shot in a quiet room, separated by everyone with tape on the floor and double masked. To finally getting COVID myself, but feeling grateful that the vaccine was doing its work and throwing the infection off within a couple of days. No hospital bed required. Now the miracle of those vaccines are routine.
So in and out again. Didn't even get my card signed this time.
Has it really been 4 years since this all started?
A dangerous virus is spreading rapidly in China, and U.S. officials are very worried that it could come here. China has more than 200 confirmed cases of coronavirus, it's called, which produces pneumonia-like symptoms. 3 people have already died from this illness, which has spread to at least 3 other Asian countries.
At 3 airports across the United States, the CDC is on guard. More than 100 officials in San Francisco, Los Angeles, and New York are screening incoming passengers from Wuhan, China, to detect the deadly coronavirus.
I caught up with an expert on infectious diseases who started her career battling HIV.
My name is Dr. Monica Gandhi, and I'm a professor of medicine at UCSF. The entire Department of Medicine here at San Francisco General were crowded into Carr Auditorium, terrified and listening to updates from Wuhan. But also we met again when we thought that there was the first case of community transmission in San Francisco. And it was 2 days later that the shelter-in-place orders came down from San Francisco because there was community transmission in March of 2020.
San Francisco Mayor London Breed announced a policy that hadn't been ordered in more than a century, since the 1918 flu.
The new public health order that we're announcing will require San Franciscans to remain at home, with exceptions only for essential outings. These measures will be disruptive to day-to-day life, but there is no need to panic.
I remember feeling faint. I remember I felt like in a way, I didn't think I'd see a pandemic like this in our lifetime. HIV I was so much more familiar with, but this was so unknown. And watching anything from New York was so hard and so sad. So yeah, it was a feeling of incredible shock, and I just felt dizzy, really, all the time.
Paul Aguilar is a long-term survivor of HIV and community liaison with the San Francisco AIDS Foundation.
I was watching ABC News, and on the screen, they had shown the mass graves that they were digging for the COVID victims. And I instantly just flashed back to 40 years earlier. And I thought to myself, I'm going to have to watch everybody die again. This is very familiar. I mean, the lack of government response, the orange clown calling it a hoax, You know, it's shades of Reagan all over again in that whole administration. It was so familiar, that sense of betrayal, that sense that our public health system had failed us again.
A lack of clear direction from the federal government and a news media and unfiltered social media, splintered along partisan political lines, only made things worse. Dr. Gandhi's work with HIV at the beginning of her career, then as head of the groundbreaking Ward 86 AIDS facility at San Francisco General and the UCSF Center for AIDS Research, has given her a clear view of how an epidemic becomes a pandemic and then endemic, a disease that is always present in a population. It's the name of her book, Endemic, a post-pandemic playbook, in which she argues that we failed to learn lessons from the battle against HIV when COVID appeared.
I was interested in writing this book in a way because I want us to have more trust in public health. A lot of this book is about increasing trust. And God forbid we get another pandemic that is spread through droplets and respiratory secretions, and it has a very high mortality rate like Ebola does. We need all the trust from the public on how to manage a new pandemic. And part of the reason I waited until the end or the time that COVID was declared, quote, over, and it's never over, but it's over in the pandemic sense, to put out this book was to say, okay, these were the mistakes made. These were the ways that we did good things, like really fast technological advances, biomedical advances, vaccines, therapeutics. Let's put it all together and let's build up our trust because we have no idea what the next pandemic will be.
Is it interesting to you that the two major epidemics you've worked with, first with HIV and AIDS and then with COVID, it was almost as if either of these pandemics had happened a decade earlier, there would have been almost nothing to be done. HIV, being able to find and identify HIV, the retrovirus, was incredibly difficult to do. And the same with the mRNA vaccines.
That is actually what a lot of chapter 2 and 3 of this book is about, is that we were in a pretty incredible technologic age to have a pandemic declared on March 11th, 2020 by the World Health Organization, which is COVID, and then by December 11th, 2020. Such a short period of time, relatively 9 months, to have a highly effective vaccine, our first emergency use authorization for the Pfizer mRNA vaccine in the United States. I can't think of any other time in history that it would have been such a short period of time. So I find that incredible. And I really want people to celebrate that and think about that this happened in an era that, you're right, 10 years earlier, we wouldn't have gotten a vaccine so quickly. And then with HIV therapy, actually, I think the other way. I think it took too long to develop HIV therapies, in the sense that 1996 was when highly active antiretroviral therapies came out. And they'd been studied before then, but it just feels to me like if the president of the United States was equally at risk for HIV, that we would have gotten antivirals more quickly.
Just as stigma delayed government action on HIV, political identity often determined how people responded to the threat from COVID.
My name is Kristen Urquiza, and I'm the co-founder of Marked by COVID. My dad was a great guy. He was a lifelong Arizonan, and he unfortunately got sick early on in the pandemic in the summer of 2020, right after the state of Arizona reopened. And the governor at the time was basically spreading misinformation that it was safe to resume normal activities. My dad was also a lifelong Republican, and when his Republican governor said that, he started to take off his mask and say, why would the governor say it's not safe if it isn't? And within a couple of weeks, he got sick and subsequently lost his life unnecessarily.
And this was before the vaccine?
Months before the vaccine. There was, no treatments too either. We knew hardly anything. And the other thing that was happening simultaneously, which really is what brought me into speaking up about it, was that the worst of this was happening in low-income communities of color. So I grew up in a 70% Hispanic, mostly immigrant neighborhood that saw not just the highest cases in Arizona, we were the hot spot for the world at the time when my dad passed. He was turned away from the hospital because there was no space for him when he first reported. There were no tests in our neighborhood. People were waiting in line for 13 hours just to get a COVID test to see if they were sick.
We're going to begin tonight with the historic milestone in this pandemic. The first vaccinations are now underway across the U.S., the most ambitious vaccination campaign in our nation's history.
That first vaccination in the U.S., outside of clinical trials, was streamed live on December 14, 2020, when ICU nurse Sandra Lindsay from Queens, New York, received her first shot.
I believe in science. As a nurse, my practice is guided by science, and so I trust science. What I don't trust is that if I contract COVID, I don't know how it will impact me or those who I come in contact with.
The hope that all Americans would also trust the science never happened. Some were skeptical of vaccines that had been developed so quickly. Others believed sometimes bizarre disinformation hyped on social media. Some wary communities had a history of mistreatment by the government. And for millions of Americans, being vaccinated or wearing a mask became intertwined with their political and cultural identities. Dr. Gandhi says there's something we didn't learn from the messaging around the HIV drug cocktail that made the infection a manageable illness for many in the mid-90s.
What we did with HIV is we got these biomedical advances like protease inhibitors, and life turned around. People, yes, partied, and it was a great moment, and it was incredible that we got antiretroviral therapy, and it's amazing that these things happened and saved people's lives and that you could have a normal life, and all of that was so important to celebrate.
Unlike the advances against HIV, COVID-19 vaccines and drugs were not as fully embraced by the general public. According to the Centers for Disease Control and Prevention, as of May 2023, only 69% of people in the U.S. completed the first series of 2 shots, and only 17% had gotten all of the COVID-19 boosters. Dr. Gandhi believes at least part of those dismal numbers are because we downplayed the benefits.
And it seemed like with vaccines in this country, we didn't celebrate them like Europe did. Europe said, hey, take the vaccine, and I promise, life goes back to total normal. And here we said, we were so confusing with our messaging. We were like, we have the vaccine, take it, but you're going to need booster after booster. And, oh, by the way, we're not going to let you go back to normal and have a normal life.
But there were complications for this and nuance. I mean, this was not an easy... There was a lot of debate about whether we should keep going. At this point in the interview, I did push back on Dr. Gandhi's take on messaging. U.S. health officials were trying to make policy out of an abundance of caution, and there was still a lot of debate about how fast we should reopen society.
It's really complicated because, in a way, the country was doing things so differently. Some states were open, some states were closed, some states had schools open, some states kept schools closed for a lot longer. We were so dramatically different in our responses. It was like 50 different countries, and we just weren't unified. And so I do think that what we should say is that vaccines prevent severe disease. It's very sad that they stopped preventing all infections. They really did prevent infections at the beginning with the Alpha variant, but then Delta variant came along and they couldn't prevent all infections.
So as you've looked back on this, when the last chapter of the book, you kind of go over what we do going forward. How do we prepare for the next epidemic? How do we keep managing the endemic pandemic?
No matter what, if we get another pandemic, it's accelerate vaccination because you need immunity as fast as possible. And it's much safer to get immunity from a vaccine than to get infected. And so accelerate vaccination, but importantly, get those vaccines out to low and middle income nations because we took way too long in this pandemic. The second step is, and I really believe this, I do think that we need to kind of celebrate the biomedical advances by easing restrictions. So saying like Denmark and Europe did, okay, get the vaccine. It may not prevent all infections. Okay, by the way, it's not going to. Here's Delta. But look, it's preventing severe disease. I really want to celebrate that. You know, if you want to go and meet with your parents and have parties, what we're trying to tell you is that the vaccines work. It just doesn't work for all infections, but it really does prevent severe disease. The third is keeping outside open. If we get another respiratory pandemic, it's much safer for people to be outside than inside. And closing beaches and parks was of no utility, and it actually drives people inside. And then the next is schools. And I do talk a lot about schools in this book because I think they're special cases and we should reopen them as soon as possible. And there was a political aspect about reopening schools, especially after teachers got vaccines. And then the next next step is reassessing testing practices after you get vaccines, stopping anything that doesn't work, like deep cleaning doesn't actually work because it is really not spread by fomites, COVID. So don't do rituals that may decrease trust in public health, like temperature screens. And then I think this is the second last step, but it's really important. We need therapies, antivirals, as well as vaccines. There will always be people still at risk for COVID-19. And vaccines are great, but we really genuinely need antivirals. And then the last step is preparing. And what I mean is preparing is we're in a state right now where public health should work on increasing trust so that people will take vaccines and acknowledging just that it was a hard time. Sorry about all the mixed messaging. It was really confusing. We didn't know, like there were lots of updated messaging, lots of new data. And I just want to tell you that we're trying to be as transparent as possible and work on public health trust. Because in this era of global warming and everything else, we're going to get another pandemic.
The CDC says that as of the 1st of March 2024, some 1,183,000 people have died from COVID-19 in the United States. Nearly 7 million required hospitalization. Millions more live with symptoms of long COVID. Those who survived the early days of the AIDS pandemic also have lessons for the trauma of COVID. Many put aside their grief in the mid-90s, when HIV became a manageable disease for most people. Only recently, those that were affected by HIV have begun to come to terms with that tremendous loss.
My name is Greg Casson. I work at Chanti, and I started a program called Honoring Our Experience for long-term survivors of HIV. But we also welcome other folks, younger folks, HIV negative, long-term survivors, so people that have lost family members, that have lost partners, that have lost their friend group. It's really interesting that there became almost like this time where people recognized that, yes, there are all these HIV positive people, but all of a sudden we had this aha of there was a community of people that went through something. I always say the same phrase, a unique and profound experience that only they would understand. And there was something powerful about creating a space for that community of people that without knowing a single person, that their experience would be known and understood by the other people in the room.
Dealing with grief 2 decades after the worst of the AIDS crisis has brought some measure of healing. But Kristen Urquiza is determined that her father's memory and the trauma of his loss and so many others isn't forgotten. Her group, Marked by COVID, is working on local commemorations and eventually a national memorial to acknowledge the COVID pandemic.
By centering sort of our commemoration on what we lost, it really widens the aperture to talk about the sort of impacts and the ripple effects across society and how we rose as a community despite the misinformation, despite, the Trump administration, despite it all, to really help one another in incredible ways, big and small. The essential workers who showed up day in and day out, not just in the hospitals, but also in the fields and factories, but also how we all within our communities, think back to March and April of 2020. Like, we were doing everything to make sure our elderly neighbors had groceries. We were doing everything to make sure that we were helping parents juggle the responsibility of homeschooling and work. I choose to really kind of focus on that time and be proud of what we did and what we were setting out to do, despite the colossal and Herculean sort of gravitas of the situation. And I think that the need to commemorate and memorialize allows us to sort of move past the divisiveness and the politicization of COVID and really remember the humanity of the moment. And I think from there is where we can really evolve to ensure that we're better prepared for whatever comes next, but also do right by who we lost so that their memories and their deaths aren't in vain.
So what did we do right and what did we do wrong when it came to fighting COVID-19 and learning from the most recent pandemic of HIV/AIDS? Some downplayed the risks while others rushed to the aid of their neighbors. We sometimes overestimated the threat while we underestimated the harm isolating would do to our children and our institutions. We developed vaccines in record time, but failed to convince everyone to get them as quickly as possible. Many were saved, but many died needlessly, often for petty reasons. Our society survived strains that could have broken it, but we are not whole and seem more interested in running from the loss than turning around and facing that trauma. We are still writing the story. Civic is working on stories about people living with long COVID. If you have a story to tell, please contact us at radio@sfpublicpress.org. I'm Mel Baker, and you've been listening to Civic. Civic comes to you from KSFP LP, 102.5 FM in San Francisco, a project of the San Francisco Public Press. TV clips used in this episode aired on CBS, MSNBC, and ABC television, as well as government press events. Joe Rogan's statement was from his public Instagram. Our theme music is by John Dillon. Additional music was supplied by the Blue Dot Sessions. Our team includes producer Liana Wilcox and executive director Lila LaHood. KSFP is a project of the San Francisco Public Press, a nonprofit investigative newsroom. Find this episode, the companion article, and all our reporting at sfpublicpress.org. Reporters and Civic contributors include Sylvie Sturm, Madison Alvarado, Jia Wu, Jessica Prado, and Michael Stoll. Civic airs Tuesdays and Thursdays at 8 a.m. and 6 p.m. on KSFP. New episodes on Thursdays. Thanks for listening.